why are we banning vapes but we're not banning cigarettes?
I have to quit or I die.
They say like vitamin diffusers, so
diffusers,
you know it infuses vitamins into the bodies.
Again, vitamin sounds healthy, but it's healthy when ingested,
Ingested.
not inhaled.
Hello and welcome to this episode of our deep dive into vaping and its impacts. In today's special, we'll be exploring the rising concerns around vaping, what's really in a vape, and the associated risks. So joining us today, we have Adjunct Associate Professor Dr. Puah from Seng Hospital, and we have Adjunct Professor Dr. Raymond Chua from the Health Sciences Authority, and Dan, who you may have seen from another article where he talked about his painful lesson as a result of his vaping habits. So let's start with Dan. Dan, you used to be a vapor, right? So how did you pick up that habit?
The bad habit started around April 2020. So I bought like a lot of like vape pods to save cash lah. And then unfortunately for me, I had shortness of breath in like, it was like COVID period. It was July 2020. Yeah, so I had my first scare was like shortness of breath lah, because remember we had the meter that they gave us to check our oxygen, the oximeter.
Pulse oximeter.
Yeah, the oximeter. Yeah, during July I had like shortness of breath and my SpO2 level was only like 87, 89.
What's SpO2?
Oh, oxygen level lah.
Saturation level.
Saturation.
That's right.
I didn't think it was serious. I thought it was just a common flu like COVID, because it was during COVID period, yeah. I had like little mild flu and then
But you were not COVID lah at that point.
I thought I was
You thought you were COVID.
hoping it was COVID.
Oh, just after 3 months of vaping.
Yeah, because unfortunately for me, because my lung couldn't handle the liquid, and I was like interchanging vaping and smoking.
You were doing both. Okay.
Yeah, I was
But you were doing both at the same time, or like today I vape, tomorrow I smoke?
I know lah. I was like, after smoking, I was like, take a vape and then like get the high from the vape. Yeah, I was like interchanging between smoking and vaping during that period of time. Initially, I wanted to quit smoking because I wanted to get married. Then I thought like it's a good way to like save costs. But unfortunately for me, I like both. Because I cannot handle the addiction because of the vape. Because I enjoy vaping because I get high actually. Smoking sort of like it's a bad habit because I have to smoke after meals. Yeah, then I was like constantly interchanging lah. Yeah, I was like never reducing the amount of smoking and never reduce the amount of vape also. Yeah, I actually did more than I was supposed to.
So I think you brought up a good point, because I think a lot of people think that you can use vapes to correct.
Yeah.
But what people don't realize is that you're actually swapping nicotine delivery device with another. And sometimes you don't even know how much nicotine is within that vape pod itself. So I think that's why you actually experience that difference between that vape and that cigarette, right? So, but thanks for sharing. I thought that was quite interesting to know as well.
I think Dr. Puah, you meet a lot of patients who come to you with like lung problems, right? Do you usually hear that like they thought that vape was safer?
So there's always that misnomer, that myth that vape is safer because it's been, all the false information out there. So people just thought, it's safer because, it smells better. It tastes better. So all these things are just to catch you off guard, get you hooked to another device.
So when you say that like vapes are not actually safer than cigarettes, right? Is it like the nicotine content or like what, there are other chemicals? What is it?
So it looks like liquid, isn't it? But actually it's solvents, but it holds propylene glycol, which is antifreeze. Vegetable glycerin, which sounds edible, but it's edible but not inhaled, right? So all these things hold all the chemicals within the vape pod itself, not to mention nicotine. So nicotine itself can cause harms. If you're young, you take nicotine, it stunts brain growth. Your attention is not very good anymore after that. Then nicotine harms the heart, the lungs, and also the brain as well.
And then the e-vaporizers, the liquids, because of it contains things like formaldehyde and benzene.
That's right. Yeah.
And all this, when ingested into the lungs, will also create like risk of cancer. So there have been, reported studies of risk of leukemia as well as nasopharyngeal carcinoma.
Actually, right, we have a visual aid to show you, right, how much cigarettes actually. So actually in one of these vape pods, there's the same amount of nicotine as up to 70 sticks of cigarettes. Now that we are seeing it, it's actually quite a lot lah.
Now I can visually see
the pyramid of death.
So I think there's an interesting concept that people don't understand as well. The cigarette is one delivery device, but there's a time limit to it. Because once you inhale everything, it ends at the filter, you throw it away. The vape pod itself comes in, it's battery operated. So it goes as long as the battery can last, and as long as your vape pot has the liquid inside it, right? So there's this term we call grazing, like cows grazing on grass.
Yeah.
So they can actually graze on vapes, and the whole day they can, like you said, just finish up to 70 cigarette sticks a day. Yeah. So it's actually really, really high.
A day?
Yeah. So if they finish up the entire pot in a day,
Yeah.
it's equivalent to 70 sticks.
I must say, Dan was not very heavy then,
one pot a day,
because we have had people who are really taking one pot a day,
What a day?
Yeah.
But
which
I mean,
is 70 cigarettes a day.
70s, yeah. Meanwhile, like you took one pot for a whole week, right?
Yeah, so I think it's really the nicotine addiction itself, right? How much hit that they need. So I think another thing about these vape pods is because you can actually adjust the electrical current sometimes, and you can increase the dose, reduce the dose, right? It's really, it's such a
Like
personalized
intuitive.
device
Yeah.
that people really take it as a toy.
It looks very cool, right? I mean, there's USB stick, it looks
Actually
like,
stick.
it looks very cool especially for the youth.
So you see this one, right? Taro flavored. It's quite cool, right?
The
Sorry,
mango,
not cool.
lychee, strawberry,
Yeah.
whatever fruits you have, you will find
In a vape form, huh?
And I think it's precisely the youths are finding it very,
Attractive.
very attractive, because I mean, cigarettes that got that pungent smell. Right? This one it smells so nice. People say that I can smell fruity smell. It's no longer the last time when people say, "Wow,
I smell smoke."
I smell secondhand smoke." No.
Yeah.
Now, in fact, people are saying that I smell fruity smell either next to the toilet, next to the room.
Yeah. Somehow right now there's like a new thing where it's not vapes but influencers, right? Not Singaporean influencers lah, other countries, influencers. They are pushing these new like e-cigarette alternatives where they say like there's no nicotine, there's no chemicals, you just inhale, right, and it tastes like fruits, tastes like candy and all that. Has it reached Singapore yet?
Yes. Actually, HSA is aware of this.
Yeah.
I mean, I think usually what they do is they market to people who are very susceptible, because they say like vitamin diffusers. So, it infuses vitamins into the bodies and all this. So,
Here I'd like to interject again.
Correct.
Yeah. Again, vitamin sounds healthy, but it's healthy when ingested. Not inhaled.
Okay.
So when you inhale it, don't know what sort of stuff that holds it together, you inhale it, it irritates the lungs, cough, chest tightness, breathlessness, all those stuff. So because you actually don't really know what's in that liquid.
Yeah.
It may look clear, it smells nice, but you really don't know. Another point I'd like to make is that to make that smell, to make that taste, you need chemicals.
yes.
Yeah.
Yeah, and those chemicals, some of it have even been shown to cause cancers.
Usually how many puffs can like one of this one?
The latest ones,
Yeah.
they actually have a sign at the bottom saying, good up to how many thousand use.
Yeah,
Right?
correct.
Yeah.
It's
So
battery.
the reason behind that is because of the metal component within the vape itself.
Oh.
So repeated heating causes it to degrade. So as it degrades, then it releases all the manganese, the arsenic, nickel, cadmium, and all that
Manganese.
jazz, yeah. And
the heavy metals.
And the heavy metals and the metalloids, yeah.
The doctor diagnosed me with pulmonary alveolar proteinosis. They determined the diagnosis through a bronchoscope, where they did a scan, where they intubate me and had to check some specimen of my lungs. There's no way for me to speak to anyone because I was intubated for around 17 days. So when they diagnosed me, it was actually my wife who actually explained to me what's happening. Most part of it I don't understand. Actually, most part of it I don't even respond or reply. Even the surgery, my wife had to sign it. Period was really painful for me. I had to go through 4 lung lavage. Per lung lavage was like $10,000. So all in was like around $40,000. The lavage and the procedure. That doesn't include the rest of the stay. Because I spent almost 3 months in hospital in total. So actually I spent so much more.
No, thanks for sharing. I think it's nice from my side to hear your perspective of it as well. Because whenever we take care of people in the ICU, we do try our best, especially to ensure comfort as well, I mean, if you don't mind, I'll share a little bit more details. It may sound a bit graphic, but hope you're okay with that. Yeah. When you mention intubation, what we actually mean is that we put in a breathing tube that goes directly into the lungs. So when a tube is inside, going directly into the lungs, you can't speak, you can't eat, and you can't drink any water as well. To describe what pulmonary alveolar proteinosis, which you said it so nicely, or PAP for short, I'm not sure. Do you know what that is? What's inside? Yeah. Okay.
You look so like passionate about things, so I didn't want to interrupt.
So inside the lungs, right? The air sacs inside lungs is filled with very, very thick, milky-like secretions. So when it's so thick, you can't really cough it out. You can't really suck it out as well.
Yep.
So that's why the lavage was important. And what your doctors did was that they had to bring you to the operating theatre. They put in what we call a rigid scope. So it's different than the usual scopes that we usually do. And what we do is that we take one part of the lung at a time, push in saline, lots of it, sometimes up to 15 liters of it, just to wash out the lung. So until we clear up that really, really thick secretions, only then you can start to breathe again. Can you imagine your air sacs just filled with all sorts of goo that oxygen just cannot penetrate through?
I think for then, even one time couldn't get everything
Yeah,
out,
right.
right? So you had to go through
Few
the
times,
big-
A few times, is it? So this was the total amount of bottles that filled with
That
the.
was only the first surgery actually.
This is the first one.
only one lung.
This is just one lung. Or
Yeah,
one
technically
one.
like one lung. And then I had to do 4 surgeries altogether. So
Oh,
like
dear.
one lung, they took like 20 saline.
Looking at your lavages,
You can see here.
yeah, you can see that I think it started off with a little bit of blood. That's why it's a bit reddish at the beginning, right? So as you can see, it's a really thick, milky secretion. So hence why you need so much of saline to go in just to wash it out. So as you clear the entire airway, then you can start to breathe better.
I mean, over the past year, I think we have started to see a rise in terms of people, using vapes that are now laced with dangerous substances, and Etomidate is one of them. And that's why last year, in 2024, we only see about 7 cases. But this year, up to date, we have already seen more than 70 cases. So it's a 10-fold increase. It's much more addictive than someone who is doing normal general vapes.
Yeah, I think when you mentioned that dangerous substances like Etomidate, right? I think as far as we know, Etomidate is supposedly a medical grade ingredient.
Correct.
Right. So how come it's dangerous when it's in a vape?
Well, it's a hospital drug, so
Okay.
it's used in the hospital.
Yes.
Yeah, so you actually have to dose it according to weight. You give it through an injectable form. You know exactly how much dose goes in. Now, if you inhale it, you don't know exactly how much Etomidate is actually in that vape pot itself. The lung is a nice bit of blood vessels surrounding it. Whatever that is inhaled in gets absorbed very quickly and gets distributed to the whole body. It's a dangerous drug.
Yeah. And that's why you see there are so many of all the people who have actually taken in Etomidate vapes. They actually suffer a lot of side effects.
Yep.
They have a bit of uncontrolled movements. They cannot talk properly. They
Yep.
can be very confused. And I think people are doing this because they want the high.
Okay, there are possible many reasons why they're doing it. Whatever the reasons, it shouldn't be any good reason at all.
What we have also done, is that we have also listed Etomidate as a Class C controlled drug under the Misuse of Drug Act.
Right.
And because of that, if they are being caught, we will then put them under the mandatory rehabilitation and urine supervision regime under the Misuse of Drug Act. We also are seeing how to move upstream, to tackle the importers, because we want to break the supply chain. Putting even Etomidate now under the Misuse of Drug Act, would actually mean that we have much harsher penalties now on the importers and traffickers from our enforcement perspective. We have always been focusing on fines. What we have realized is fine may not be sufficient, and that's where we actually now refine our whole enforcement regime. Just now we mentioned about general vapes.
Yep.
So we fined when in the first offense. Then after that, if you are a repeat offender, then we will make sure that you go for a rehabilitation regime at Health Promotion Board.
Okay.
And then after that, of course, if you're third time, we'll prosecute you.
For people that we've heard from, right, sometimes they are hesitant to seek treatment or to turn themselves in because they're afraid that it might be on their record. So is that something that actually happens? Especially if I tried Etomidate once, now I'm addicted. It's been a few months, right? How do I get help without facing repercussions, I guess?
As someone from the ministry, we will really want to encourage the people who are really looking for quitting of their vapes habits or cigarette smoking habits, please approach the correct authorities, because we have partnered with different agents, social service agencies, as well as IMH, as well as also HPB, so there is a lot of different helplines and avenues that they can approach. If they do so, actually there will not be any records. That will be attributed to the individuals. So we encourage the individuals or their family members to bring them to these agencies. Actually, now we have actually even located the bins. Remember the vape bins at all these different centers, so that they can actually dispose their vapes there as well.
Right.
So you can see that a lot of our whole regime now is really focused on rehabilitation, because we want to actually help the individuals, the people who vape, either the general vapers or the Etomidate vapers.
The journey that people need to go through, right, when they get into contact with a Quit Vape hotline, what does it start with? Is it like straight away, okay, I refer you to a doctor, get your nicotine patch, or like what's the process there?
I think generally it starts off with counseling, understanding why the person wants to vape or wants to smoke.
Yeah.
I think it's always to find out what the root cause is. How heavy is their addiction patterns? What are the dependencies that they are going to do the vaping or the smoking? Right. I don't know whether
So for Dan, did you have to go through like a whole quitting process after your vaping journey?
I didn't have to go through the surgery made me do it.
What was your experience going through
I think the pain actually caused me to quit because it was a near life and death experience for me, unfortunately. So it's like I have to quit or I die moment back then. And thankfully I survived.
We've been talking so much about smoking, vaping, So what do you think? Which is the worst?
This is a
Both.
trick question. Trick question, is it?
Yeah.
I can say both is harmful. So
I think that absolutely correct. Yeah.
Bingo.
Yeah. I can't imagine a world where inhaling any form of smoke is healthy for the lungs. So why start and why do it?
So why are we banning vapes but we're not banning cigarettes if they are equally terrible for our bodies?
When vapes came out, we've looked through the evidence. I think they were saying that it's a gateway to actually help people quit smoking, but we found limited evidence, for that hypothesis. So I think rather than to allow it, to come in and be the mainstay, and we decided we might as well stop it and ban the importation, supply, sales, use, and possession of e-vaporizers. I think if we have gone back time, and if smoking now is being introduced at this point in time, we would also have said that we have banned smoking.
Yeah, it's bad. all I can say is just bad.
So I think if you are really stressed, maintain a healthy lifestyle, exercise regularly.
And with that, do you have any last words that you want to share with people who are currently addicted to vaping?
Bin the vapes, that you already have, so that you actually start by saying that you are not going to vape anymore. Give yourself a second chance. Tell yourself that you want to kick the habits, volunteer, and go to the Quit Vape program that we have, or you can approach any of the social service agencies or IMH.
It's not worth it to start, and if possible, if you're struggling, seek help. Yeah, it was really expensive lesson for me.
One of my main messages is that we are here to help. Please come forward. No one's going to judge you. In fact, everybody wants to help you, because at the end of the day, getting you healthier gets the nation healthier.
So the biggest takeaway from today's episode is that vapes are not better than cigarettes. Right, doctor?
Worse. It's worse.
Because it can be a gateway for you to try more harmful substances, harder substances, and it can contain the same amount of nicotine as up to 70 cigarettes. So thanks for joining us on today's episode, Dr. Puah, Dan, and Professor Chua. And thanks for tuning in as we unpack the serious harms that vapes bring. In our next episode, we're going a little bit deeper. We're talking about K-pods and the emotional trauma and the impact that it has on the users and their families. So don't forget to check it out in the link below.